I'm Dr. Elizabeth Wheeler, and this is Dr. Kristen Grader. We're coming to you from Pittsburgh Performance Physical Therapy in Pittsburgh, Pennsylvania. This is a quick video on foam rolling today. So there's a couple different types of foam rolls, and then there's a couple different reasons why you might foam roll. There's two good times, and one might be before workout. If you have kind of a chronic muscle strain or tightness, that might feel good before and loosen up, and then afterward might be a good time as well. So increase some blood flow and circulation to the muscle groups, and sometimes it just depends on your body as to when it might feel better to do it.
So as Dr. Wheeler was saying, everyone's body's a little bit different, but the purpose of foam rolling is pretty much the same throughout. So some myofascial release. So you have our muscle, and then we have our fascia, which keep our muscles where they're supposed to be and working efficiently. That can get tight over time. And so it's pretty much a soft tissue technique you can do to yourself. It's also really good for trigger point releases. So think of all those areas in your body where you feel that muscle knot, a very good way of working through that to release it before or after exercise. It also increases blood flow. So does stretching, so does actually working out. But what this does is it really brings the blood flow to the muscle you just worked or you are going to work for an increased recovery time afterwards. And there's also some ways you can self and safely mobilize your spine through that. We won't get in that today. We are focusing more on the lower extremity, but we'll show you some ways to set yourself up. To work through your calves, place both legs, again, the soft part of your calf on the foam roller, rolling from above your ankle to below your knee. Now, sometimes one leg at a time can be more effective so you can get the inner and outer portion of your calf. And just like your hamstring, adding a leg on top will increase the pressure down to your muscle. Starting with our glute and piriformis region, if you start by sitting on your foam roller, gently cross the leg you're going to work on over the other, or keep your knees bent but hips flexed. Gently roll back and forth along that soft tissue. Again, rolling side to side based on where you might feel your tension. Moving down towards your hamstring, so the back of your thigh, use your arms to lift your body up, gently rolling from right below your buttock to right above your knee, being careful not to cross over the joint or any sensitive area. If you need more pressure, crossing your leg to add more resistance down if your muscle is more tense. To get to your IT band, so the outer thigh, lie on your side, use the opposite leg to give support along with your arm, gently rolling from right below your buttock to again above your knee, being careful to avoid any bony parts that may be uncomfortable, focusing on your soft tissue. Slow and controlled movement. To address the front of your thigh, also known as your quads and hip flexors, starting on your stomach, putting the foam roller on your thigh, gently rolling from above your knee towards your hip. Now, if you want to do one leg at a time, which would reduce how much pressure is on your thigh, bringing one leg to the side to allow your arms and your leg to give support. Gently rolling up and down. This may allow a little higher up into the thigh as well to get more of that hip flexor region.
So again, the purpose of foam rolling is to iron out some of those knots, get the muscles released a little bit. It's kind of nice before you stretch, nice for recovery, get some blood circulation back and get things loosened up. If you feel like these are not doable, so foam rolling isn't necessarily for everybody. You can notice from the videos, you kind of need some upper body strength, kind of a little bit weird maneuvering at times. And if you felt like you tried some of these or you have in the past and it just doesn't work for you, I wanted to show you, they make these handheld rolling tools, and they kind of do the same thing that the foam roll would do, but you don't have to get on the floor. You can just stand. Kristen will demonstrate real quick. And basically these roll, and you just kind of in the same way roll out some of those muscles, and it feels great. So that's a quick way to do it, even after post-run, or like I said, if you find yourself not being able to get in some of these positions comfortably.
And remember, it might be uncomfortable, just like a stretch, but it should never be painful. So if you are having any issues, feel free to reach out with questions or talk to your own provider.
Thanks again for watching. Don't forget to like and subscribe to our channels for future videos. Thank you and be well.